Welcome to Body Solutions, where total physical fitness is directed by physical therapists. Today I'm going to talk about the proper way of breathing for relaxation, for health, and for decreased pain. Most Americans are chest breathers. What that means is when they inhale and exhale, you'll see their chest go up and down. There are two problems with that way of breathing. First, when you breathe with your chest, it tends to engage the stress muscles in your neck because they're also the accessory muscles. They're the accessory muscles that help with breathing because they help pull your ribcage up and down. And that way of breathing already tightens muscles that tend to be tightened from desk work, from stress, from repetitive reaching, from poor posture. So we want to do everything that we can to avoid engaging those muscles excessively. The second problem with chest breathing is it tends to engage the part of your sympathetic nervous system, the part of your nervous system that engages when you're under stress. It's sort of like the fight or flight syndrome. Basically, you tend to release more of these stress hormones that tend to tighten your muscles and get you ready for action. And the drawback to that is you're going to be even more stressed. So ideally, the best way to breathe is diaphragmatic breathing or stomach breathing. And that way of breathing involves no chest activation whatsoever. And in fact, when you inhale, you want to think about filling in the part of your stomach sort of just below your belly button, followed by where your belly button is, and then exhale. And that process should occur very naturally. It should not be forced. And I'll demonstrate it right now. So I'm going to slowly inhale, and I'll put my hands sort of on my stomach here, and you'll see sort of distends, and then you naturally exhale. If you notice, during that breath, there was no chest movement. Everything here was relaxed, and you just naturally, again, let the air in, and then back down. Okay, now, you don't want to force this breathing. You want to apply only about 70% effort, and just naturally get used to relaxing all the muscles up here in your torso, your trunk, your neck, and just think about sort of relaxing the stomach and letting it fill with air, letting the diaphragm drop to let the air in, and then naturally exhale to let the air out. And the benefit of this way of breathing is two things. One, the diaphragm has connections to lumbar spine, sort of myofascial tissues that help support your back. So engaging these muscles helps sort of pull on the myofascia. It also helps massage some of the internal organs within your body, which is great because it gives it blood flow and it's great for overall health. The second benefit has to do with that nervous system hormone releasing aspect. When you diaphragmatic breathe, it tends to activate the parasympathetic nervous system, which is the part of your nervous system that helps you calm down and relax. And who couldn't use more relaxation, right? So this way of breathing tends to decrease stress, help you relax, help the muscles in your neck, especially up here, decrease in tone or decrease in muscle spasms. So it's just a great way to breathe to help you slow down, unwind, and decrease some of that tension in your neck. So you want to think about breathing this way throughout the day. It takes a lot of practice. The way that you breathe is habitual. So you want to change your habits, and that takes a lot of hours of practice. But don't give up. Just every day, spend a few minutes here, a few minutes there, and eventually it'll be a new habit, and you'll be much more relaxed.